Dr. Joseph Heyman. He is a board-certified obstetrician gynecologist practicing for over 30 years. He has a private practice in Amesbury, Massachusetts. Dr. Heyman has been a member of the American Medical Association Board of Trustees since 2002 and is currently serving as chair. The AMA represents the American medicine industry and serves as an advocate for the physician, the patient, and the profession. Welcome, sir. You have 5 minutes to make your
Thank you, Madam Chairwoman. My name is Joe Heyman, and I am chair of the Board of Trustees of the American Medical Association, also a gynecologist in solo practice in Amesbury, Massachusetts. The AMA thanks you, Chairwoman Velasquez, and Ranking Member Graves, and members of the committee for your leadership in holding this hearing. America's seniors, the physicians who care for them, many of whom, like me, are small business owners, and Congress all face an annual Medicare problem. The current Medicare physician payment formula, known as the Sustainable Growth Rate, or SGR, ties physician payments to the GDP. Yet while the economy is going down, the healthcare needs of seniors are going up. The SGR is not reality and has threatened steep cuts every year since 2002. Over the last 6 years, Congress and the physician community have had to scramble to achieve multiple 11th-hour interventions to ward off these cuts and preserve patients' access to care. And now, due to the SGR, a 21% cut is scheduled for January 1st, with cuts totaling 40% projected in the coming decade. These cuts, if not stopped, will impair patient access. The vast majority of physician practices are small businesses and cannot absorb these steep losses. No small business could survive under a business model that dictates steep cuts year after year. A solution is needed now. The administration's budget provides a big part of the solution. It assumes a new baseline in forecasting future spending on Medicare physicians' services. This is known as rebasing, and we strongly support it. With rebasing, the administration uses a new baseline to reflect the realistic assumption that Congress will continue to preserve seniors' access to care by stopping future SGR cuts. After all, the primary purpose of a budget baseline is to provide policymakers with a clear forecast of projected spending and taxpayer obligations. In previous years, budget forecasts have inaccurately assumed that the projected 40% in physician cuts would occur. In reality, Congress has interceded 6 times since 2003 to legislatively ignore the physician payment baseline and provide temporary payment increases. Rebasing is imperative for several reasons. It would pave the way for Congress to repeal the SGR. Congress could then establish a new Medicare physician payment system that allows annual updates that accurately reflect increases in medical practice costs with appropriate incentives for utilization, efficiency, and quality. This two-step process, that is, rebasing along with repeal of the SGR, will preserve access to high-quality, cost-effective health care for our senior and disabled patients. And since projected SGR cuts exacerbate ongoing physician shortages, rebasing and repeal of the SGR will favorably affect the future supply of physicians. Further, adopting a new baseline and repealing the SGR means physicians in Congress can focus on other important reforms like health insurance for the uninsured, adoption of health information technology, and investment in quality improvement and prevention programs. Finally, a new baseline and positive physician updates would bolster our economy. It would help sustain the jobs of nearly 3 million employees and benefit millions of patients and physicians across the country. For example, if the 40% cut takes effect, New York would lose $17 billion by 2016 for the care of elderly and disabled patients, and Missouri would lose $4 billion. And every state represented on this committee similarly would stand to lose billions. The stakes are too high to continue this cycle of 11th-hour temporary SGR fixes. We urge the committee and Congress to support adoption of a new baseline in the fiscal year 2010 budget resolution and pave the way for a new Medicare physician payment system that best serves patients and employees across the country, as well as our entire healthcare system. Thank you very much for the opportunity to be here today.